40% of the people who have died of COVID-19 in Michigan have been African American, even though they make up less than 15% of the population in our state.
Yesterday, Governor Whitmer announced the members of a task force that will study the causes and impact of racial disparities in fighting this virus. And News 8's Emily Linnert talked with a Grand Valley State employee who's been appointed to that task force.
Connie Dang is the director of GVSU's Office of Multicultural Affairs and Special Assistant for Inclusive Community Outreach. She's one of 23 people chosen to serve on the Coronavirus Task Force on Racial Disparities. Connie, thank you for joining us. We know that racial disparities in healthcare have been happening for generations here in Michigan. COVID-19 has brought it to the surface now. Are there things that can be done right now to start fixing this?
Yes, so Emily, thank you for the opportunity to speak about this newly created task force. As you know, yesterday, Governor Whitmer signed an executive order to create the Michigan Coronavirus Task Force on Racial Disparities.
So what do you think that you bring to this task force, Connie?
I'm so excited again to be part of this important work. It is my hope that based on the findings, we will recommend, develop, and implement actions in ways that remove systemic barriers and close the disparity gaps for communities of color. I think some of the ways that I can contribute to the work of the task force is to increase transparency in reporting data regarding the racial and ethnic impact of COVID-19, remove, as I mentioned earlier, to remove some barriers to accessing physical and mental health care, reduce the impact of medical bias in testing, treatment, and also to develop and improve systems for supporting long-term economic recovery and mental health care following a pandemic.
Connie Dang from GVSU, thank you so much for joining us and best of luck on this important task force.
I'm glad to be here.